For years, mental health disorders have not received the attention as do the more familiar physical conditions Americans suffer from. These very serious mental health issues are normally ignored until dramatic or horrible events take place. Recently, the President of the United States addressed the issues, and this is what the President had to say.
We all know somebody, a family member, a friend, a neighbor, who has struggled or will struggle with mental health issues at some point in their lives. Michelle and I have both known people who battled severe depression over the years, people we love. And oftentimes those who seek treatment go on to lead happy, healthy, productive lives. So we know that recovery is possible, we know help is available, and yet as a society we often think about mental health differently than other forms of health. You see commercials on TV about a whole array of physical health issues, some of them very personal. And yet, we whisper about mental health issues and avoid asking too many questions. And the brain's a body part too. We just know less about it. And there should be no shame in discussing or seeking help for treatable illnesses that affect too many people that we love. We've got to get rid of that embarrassment. We've got to get rid of that stigma. Too many Americans who struggle with mental health illnesses are still suffering in silence rather than seeking help. And we need to see it that men and women who would never hesitate to go see a doctor if they had a broken arm or came down with the flu, that they have that same attitude when it comes to their mental health.
Hi, welcome to Perspectives. I'm Harvey, Elwood. I'm your host. Today we're going to have a very important conversation with some very important and leading people in the areas of mental health. It's an area that we need to discuss. It needs to be more prominently expressed and talked about across our state, and that's why we're doing this show. Suicide, depression, Alzheimer's disease, dementia, anorexia, schizophrenia, anxiety, hallucinations, all categorized as mental health disorders. And we have agencies that are working to address those issues in the lives of so many of our citizens. And today we're joined by Mr. Willie. He is the director of the Orangeburg Mental Health Organization. And we're also joined by the State Department Director of Mental Health, Mr. John Magill. Welcome, gentlemen, to the Perspectives.
Thank you.
So often in society, it's the physical conditions of people that we're most concerned with. Heart disease, diabetes, and those things that we can see and feel. But the mental disorders oftentimes are put on the back burner. And even to coin a phrase, oftentimes people says, my uncle, who we keep locked away in the basement. It's almost a way of trying to hide the things that are really important. Of course, we know we can't see mental disease. It's not like the other conditions that people suffer from. You gentlemen are working really hard and trying to address these things in a large state, in a large population. And I've asked you to give us a rundown of what's currently trending in your department. And I'll give you the floor and let you tell us what's going on.
Okay, well, let me tell you a little bit about from the state perspective, and then Willie can sort of zero in on Orangeburg. It might surprise your listeners to know that the state of South Carolina has a rich history in providing mental health services. As a matter of fact, back in the 1690s, if you can believe this, the Lords Proprietors of the Carolina colony often spoke about the need for some services for those who were less able to take care of themselves. Most of this down in the peninsula area. And then in the 1760s, there was an attempt down in Charleston. But the state of South Carolina in 1820 said, you know something? We have to do something about mental illness. And in that regard, they appropriated money for the design and construction of a hospital in Columbia. And that hospital opened in 1828.
Wow.
First patient. Still have the record of that first patient. Now, the mental health system in South Carolina grew principally as an inpatient hospital system, and it reached its peak in the 1960s. In the mid-1960s, we had two large psychiatric hospitals, one in the downtown area, what was referred to as Bow Street. It had about 3,600 patients there. Wow. And then a hospital out in the north area called Crass Sparrow that had about 3,000. So from the mid-60s to today, you have seen a gradual declination of the numbers in our hospitals, but a tremendous increase in the number of people treated in outpatient. We have, in this state agency, since we have good records, have treated about 1 million people in our inpatient hospitals and nursing homes, but we treated almost 3 million in our community mental health centers around the state. So to bring it up to the day, just to round it off, we operate 4 hospitals, 3 in Columbia, 1 in Anderson. We operate 4 nursing homes. That surprises people. Large nursing homes.
What's the capacity of the nursing homes?
Well, the 2 veteran nursing homes, each one has 220 beds. That's in Anderson and in Walterboro. Then we have 2 in Columbia. One is a veterans nursing home, again, of about 75, and the other is a general psychiatric nursing home of about 180. So on any night, we have close to 700 or more nursing home patients, which makes us a large nursing home operation as well as hospital operation. Then we have 17 community mental health centers around the state, Orangeburg being one of them, and there is a mental health presence in every county in South Carolina. We treat about 100,000 people a year. Wow. And that does not include people that we may see in jails, detention centers, or other environments. That's an additional 40,000 a year. So it's a large operation. We're all state-run, so your public mental health system here in South Carolina is one of the oldest in the country, but also is one of the most robust because we're all part of the same system.
Right.
And Willie, I don't know if you want to describe the Orangeburg system, perhaps.
Please. Certainly. In Orangeburg, we have a fairly comprehensive mental health center. At this point, we serve probably on an ongoing basis about 1,500 people. In a year's time, we normally have approximately 2,500 that we come in contact with. We have multiple services that we provide, such as for children, for adults. We do work within the school system. We have initiatives where we work within the DJJ office, the DSS office, as well as we have a couple of programs, one for children, one for adults, that we actually go into the homes and work with people. So we're branching out into the community throughout Orangeburg, Calhoun, and Bamberg counties to ensure that our clients receive what they need. We also have inside our building services to where we can assist clients in getting medication who don't have the funding to do so. And if they have Medicaid, Medicare, private insurance, even self-pay, we can assist them in providing medication within our organization so they don't have to go to the pharmacy and wait, that sort of thing. Sure. So we have these services available, and I do think that Orangeburg is an area that continues to grow. We, of course, have our office here within on this strip here. At one time, we were providing some services outside in a separate building, but we brought all our services under this roof. So,
but you do have some care providers elsewhere that have offices that people are seen by.
Right. We have an office in Denmark. We have an office in Hollyhill, and we have an office in St. Matthews.
Sure. Because Orangeburg County, is, of course, is the 3rd largest county of all in the state.
Yes.
It's very wide and very spread out.
Yes.
And it's good to know that you guys have those satellite offices and facilities where people can be seen. Orangeburg, in particular, doesn't have a large homeless population. It doesn't necessarily have a large homeless population. Columbia, Charleston, maybe Greenville, larger cities, they do. How is that working in terms of area of mental health?
Well, I'll give you an example of Columbia. We actually, our community mental health center in Columbia, which is the largest one in the state, they provide services in a cooperative arrangement with some of the homeless shelters there. And as a matter of fact, I helped support the establishment of one financially so that we would have some access to use some of the residential beds there. But I'll mention two things that I think, honestly, that a lot of people are interested in, and you have some of it right here in this community as well. Two of the marquee programs that the State Mental Health Agency does, and then it sort of spreads down to our centers. One is we have the largest telepsychiatry ER consultation program in the country.
Explain what that is.
Okay, it gives an ER the ability to have high definition equipment where a patient can be presented to my staff of psychiatrists for recommendations about medication management as well as other types of management. And we're in 20 hospitals around the state of South Carolina. I have a separate staff of psychiatrists that do this work, and we're functioning about 16 hours a day. We'll go back to 24 hours a day before long. But we've seen over 15,000 consultations in this program. Now, the Duke Endowment in North Carolina helped give me the money to start this program. So philanthropy was the backdrop of getting this started, and now the state of South Carolina is slowly going to be picking up more of the cost of that. The other one is the school-based mental health program.
Important, yes.
Extremely important, and again, one of the largest ones. We're in 385 public schools in South Carolina. So we've got almost 200 counselors who are assigned to those schools. Sometimes they're one counselor, one school. Other times, maybe a counselor has to cover 2 or 3 schools. But each year, they treat about 12,000 children in those schools. And they're in primary, middle, and high school, depends. So if a community and a school district wants to participate with us, then we very happily and aggressively go out and try to establish the school-based mental health program. And you have some here in Orangeburg.
Yes, we do. Matter of fact, we have 5 mental health counselors. We're in 9 schools. Those are the ones that we have assigned to. We have several contracts, District 5, District 3, and we're continuously looking at opportunities to get into other schools. That, I think, is very important because it allows us to be able to see children, for one, more rapidly,
Sure.
and 2, more consistently.
Sure.
It provides then for a parent who cannot get their child in consistently for us to see them at the school, at the time that they're there, and it provides for them an opportunity to also receive their education.
A continuum
Yes.
of care.
That's right, and they're able to stay in school. So that's important, and we're continuing to work to try
Because
to
all too often in recent times, people become concerned about mental health issues after some crises
Right.
takes place. And of course, at that point, it is too late. What your agencies are doing is being very proactive, and particularly in the area of schools. What happens to a young person, let's say, who may be undiagnosed with a condition, who happens to be a student in a school, and then is the target of bullying? In some instances, we've seen what's happened outside the state of South Carolina with this population of young people who may feel ostracized or bullied or likewise. But what you guys are doing, I would imagine, is to address these.
I'll take a crack at it, and then Willie can end. What I like about school-based mental health programs is if we're taking a trained professional counselor, which we have lots of them, and we put them, embed them in that school, they then become a resource for everybody else in the school.
Mm-hmm.
So if an administrator or a resource officer or another student comes and says, I need some assistance,
Yes.
I am being bullied,
Yes.
you have somebody that can, in a counseling perspective, work on that problem,
Yes.
but also can help make that information available to the whole school community.
Right.
So it's a bit of an early warning system,
Sure,
to be
sure.
honest with you.
As well as in the area of suicide prevention,
Correct.
which is extremely important. Ladies and gentlemen, this is New Perspectives. Our guest this morning or this afternoon, or however we cut this out, because we're gonna have to cut that one. I guess, Mr. Willie Priester of the Orangeburg Area Mental Health Organization and the state's director of mental health, Mr. John Magill. Thank you, gentlemen. Is there any additional information we need to get out to the public?
If you'd let me mention something, the funding has been an issue in mental health.
Okay.
Now, it's not brand new. Funding cycles ebb and flow, as you know. Back in the early 60s, during the Kennedy administration, a lot of emphasis was put and federal money went to states and in communities to establish community mental health centers. So there is a history of it, but it ebbs and flows according to different administrations.
Why would you say that is?
Well, honestly, I think you hit on it a moment ago, and that is sometimes unfortunate crises are those things that grab attention. And while they're tragic when they happen, it does raise the profile, and that's happened recently. We took tremendous budget cuts as a state mental health agency, but we're now beginning to see some of that restored.
Well, it's being restored as a result of the incidents which have been taking place. Tragic,
Yeah.
horrible incidents.
Well, partly.
Okay.
Partly, because we have a chief executive now who's interested. We have members of the General Assembly, and they have been supporting actually for a couple of years.
Okay.
So we'll move this thing back. Orangeburg County, it would be helpful if Orangeburg County was more supported financially. Many of the counties put quite a bit of money into their center operation. Willie, what is Orangeburg County putting in?
At this juncture, we've not received any funding over the last couple of years.
Okay.
Right.
All right.
So,
Well, that's an issue that, and you know, our show is not just a show that records and documents what goes on. We also work as an advocate group to speak to local government about the issues that concern this community most. And you have a friend here. I can tell you that I've been an activist for your agency in the past. I've worked for many individuals who had issues, who had to come here, and you guys have helped them tremendously. Patients who have been involved in unfortunately, the criminal justice system, who were there because of some mental impairment, some problem, some, of course, having to take Habital and those kinds of things, but not diagnosed properly, and then finding themselves in the jail system. And we work with advocates with the courts, and your agency here has done a tremendous amount of work. Mrs. Hagler, who is now in Calhoun County, is one of our very good associates. We work with her very closely. And this is an area we're very concerned about, I assure you.
If I'm not mistaken, you received a statewide award yourself in mental health a couple weeks ago from Mental Health America, the South Carolina chapter. You received an award for your work in this area. So thank you for doing that as well.
Well, we want to thank you because we believe that this is an issue and a concern for everybody, everywhere. It is not just those people who have family members or who themselves suffer from situations, or the agencies who rely on this as their employment. It is an issue that concerns our entire society, and I'm so glad and gratified that you guys are working. One other thing before I let you go is Medicaid and funding. Are we receiving our fair share in funding from Medicaid sources? Can you say?
That's kind of hard to say what a fair share is. My budget right now has about as much Medicaid revenue as it does general state appropriations. So it is a large chunk. Now, having said that, our people are needed.
Sure.
We need to continue to have the resources to provide the services to the Medicaid population, so we champion that.
Sure. Ladies and gentlemen, again, this is New Perspectives. I want to thank our guests today for fantastic conversation, for their service to the state and this community.
Let me say this before you conclude. I think it would be awfully nice for the people to know, and in many cases they're not aware of the fact that we do have opportunities for them to be seen here. Sometimes people believe they've got to wait 2 months, 3 months for an appointment. What we have done, we've enacted a system here where you can walk in and you can be seen the same day. And I think that provides comfort for people when they need a service, they need assistance. that they can get it and get it now. So I'd like
It's
to share that.
emergency care.
Emergency care, you can come in and be seen, or even.
And the emergency services are really like pricey services.
Yes.
Individuals who need to come in. And what's the cost for that? Is there a nominal fee that's charged for that? If somebody doesn't have any insurance, do they just walk in?
If they don't have insurance, certainly, they can walk in and look at that service.
Fantastic. Anything else we need to add to this?
I think that's all.
Ladies,
Thanks for doing it.
Thank you so much for having us. Thank you, gentlemen, for all the work you've done.